Okay. Welcome, everybody, and thank you for coming. I'm Cheryl Heller, Chair of Design for Social Innovation at SVA, and this is the fourth in our series of webinars. We're doing these to give you a sense of the faculty of the new program and to let you have a little window into the various careers that they have and the lives they have and the way that they're using design to impact the world. So this is not in any sequence of the curriculum we're having, but we just are introducing you in a deeper way to some of the things and some of the people that will be involved. Tonight we have Lisa Nugent, who is really an extraordinary designer, and she'll talk a little bit about what she does, but if you think about her role, she works at a company and she has an effect on literally billions of people's lives and uses design in a way to intentionally change people's health, improve their health, and change their behavior. So with that, I will turn it over to Lisa.
Okay, thank you. And we'll start talking a little bit about health and the reason why innovation in health is important for today. And I'm also going to go through a case study of work that changed my practice in a very dramatic way and brought me into the world of health. Let me advance this. The MFA Design for Social Innovation, as you've probably read on the website, was born of the conviction that an abundant and sustainable future will come from the integration of wisdom from diverse experts, countries, and across generations, and from game-changing collaboration between them. So in the world of designing better health, what's the integration of wisdom and game-changing collaboration that will change the world of health? What do we mean? And what specific world am I talking about? With science breakthroughs, fatal diseases are becoming chronic conditions, and the management of patients' health and well-being is dependent on the patient, not the physician. So an example of that is HIV. In the early 80s, when HIV was discovered as a virus, it was pretty much a death sentence. And yet today, people living with HIV can have a quality of life, and they can have a long life as long as they manage their health and their therapy. And that's something that they need to do themselves in their own home. The caring for chronic conditions is moving out of the hospital, out of the patient physician's office, and into the home. Until recently, design and health communities, for the most part, have been siloed. We've overlooked one another. And yet, with emerging technologies that can empower patients, the stage is set for new types of collaboration. So I want to give you a few statistics. Because what do we mean by chronic illness? And as far as how broad does that affect, and these are just statistics for the US. So nearly 90 million Americans currently have a chronic condition such as diabetes, hypertension, arthritis, dementia. And this is surprising. This was surprising to me. More than 1/3 of young adults aged 18 to 34 have at least one chronic disease. We expect that of adults and elders, but I don't think we think of chronic illness as a young adult condition. Chronic conditions account for 3/4 of direct medical care costs. So it's a key contributor to the costliness that is the primary business model being used to care for these patients. Physicians, practices, and hospitals were primarily set up to deal with acute disease. So what do I mean by acute disease? Acute disease is if you have an appendicitis and you need to go into the hospital and you have an operation, the hospital well. So acute condition is something that a doctor can intervene and you're well. And a chronic condition is something that we live with. So rather than hoping that improving the efficiency of caregivers working within these business models of acute care will solve these problems, what we need is a more robust solution that must be found by creating new business models for managing chronic illness or chronic disease. And this is an area that I believe design and designers can contribute. And in this case study, which you'll see, we'll go into more detail. In the following slides, this case study will illustrate methods of co-creation with patients, healthcare professionals, and designers that resulted in a prototype tool measuring quality of life for teens. While I was teaching at Art Center, I won a Robert Wood Johnson Foundation grant, and this work completely redirected my practice. My background was in branding. I had a firm in Los Angeles for 12 years and doing more experimental design, more personal expression. And when I realized that in the world of healthcare, design could have really an impact in somebody's quality of life, and that there was an openness in the healthcare world to embrace design for collaboration, it just opened a whole new world. And I'm hoping that through this presentation, it might spark some interest for you as well. So based on this kind of life-changing experience of working in this grant, I took the opportunity to work at Johnson & Johnson, where now I deploy the same methods of research and gaining insights, and once again invite you to consider the global health arena as a new and growing frontier for social innovation. Living Profiles is the name of the project. It's a part of Project Health Design, which was a nationally funded about 3-year program. It included 9 institutions. Art Center was one of them. And it was a call for reimagining personal health records. And our proposal and grant was looking at teenagers with chronic health conditions. And why teens? Teens with chronic conditions are at risk. It's a population that is underserved. These kids, as they transition out of the home and go to college or go to work, they leave this home environment, they leave a very caring pediatric support network, and they make some poor choices. And often these kids can die, or they have implications that they have to live with throughout their life. So we were looking at how to help these kids transition from pediatric care into adult conditions. And we collaborated with children's Hospital of Orange County in California, as well as Stanford University. So this was a collaboration between designers, physicians, and patients. So we knew that teenagers with chronic illness, or any teenagers, they're a difficult population to reach. And in the healthcare space, they pretty much cross their fingers and hope that these kids age out successfully and healthily. And yet we thought, there's got to be a way to engage them. And we wanted to discover what teens felt were meaningful, and we wanted to understand what would sustain their interest. So we were able and very fortunate to work with 31 teens with conditions that ranged from hemophilia, sickle cell, juvenile arthritis, lupus, serious conditions. And we're able to gain their insights, the perspective of the world, and co-create with them some innovations. Some of the methods that we used are reflective home activities. Another term is probes. These are exercises that are very open-ended. They ask for interpretation, they ask for metaphor, they require drawing. In this case, there was music, playlists, mapping. And when we first introduced this concept, some of the nurses involved were very concerned that this would cause additional stress for the patients. They said, how are they going to know what to answer? And we said, no, there's no right or wrong answer, and it's a means of expression. We want to hear from them how they view the world. So fortunately, we were able to deploy these, and we've continued to use these methods as really discovery tools. In follow-up, we had one-on-one interviews. We went into people's homes. We spent a couple hours. We sat with the teens. Because they were teenagers, we invited them to bring a friend, and we conducted dyads. Often with teens, it's a good idea for them to have a friend, a peer. It makes them feel more comfortable, and it also keeps them sort of honest. And so during the course of these interviews, not only did we hear from the teen with a chronic condition, but we're able to make a comparison and get some rich dialogue with sort of the world perspective and points of view around health and wellness from their peer. One of the things I just want to use this slide as a setup. So as we go through this case study, this is on your radar. What we learned through some word exercises with these kids is that when we ask them to map out sort of all of the things that are about health and wellness and fun, to chart what's teen-centric and what's for everyone, what emerged was this gap. There was nothing that they identified as teen-centric and had to do with wellness, nothing for them specifically. And granted, this is a small study, but I always show this because I think that it's something worth delving into. And why is that? And why can't we figure out a way to support these teens in a more meaningful way, in ways that they feel are for them? So now I'm going to go into some of the exercises and what we got back. Some of the exercises involved mapping. For example, map your future life until you turn 21. The age of these teens was from 14 to 19. We also asked them to chart their future health. And this is a typical example of what we got back, and hopefully you can see on your screen some of the detail. What we see here is a lot of surfing, a lot of traveling, a choice of graduating from high school, going to college, and at crossroads of going into the fire academy or going to nursing school. And all of these maps were filled with activities and dilemmas that they saw coming up, decisions that they had to make. Very active. When we asked teens to think a little bit more about their charting their health and well-being, what their future health and well-being, then we got a chart like this, which was a low point. What are the highs and lows of your future? And so here's an example. SATs, junior year, that's a low point. And high point is a trip to Hong Kong. Yeah, senior year, we get down to college applications, another low point, the first year of college low, and then graduation, getting married, and then family kind of evens out. Very similar, always the same, always. And what struck us was what was missing. What's missing? What's missing from these maps and charts? And it's the kidney transplants, the hospitalizations, and the daily pills. These kids are in and out of the hospital several times a year, if not monthly, for some treatments. Several of these kids had had kidney transplants or were waiting for a kidney transplant. And they are taking maybe 15 pills a day. So these are sick kids, and yet we never saw a mention of them listing their hospitals, their conditions, fears about their conditions and their future. It just did not show up. It was amazing. They do not identify with their disease. Other exercises involved inquiry and sharing personal information with their doctors. And just as a note, and I think this is kind of a human fact, if you ask a teen if they have questions, they'll say no. If you ask, would they like to know more about something, then they'll open up. And here's an example of what we got. So this is part of a question. So you were at the doctor's office and you wish you could have asked or talked more about what? And this was written by a 15-year-old. How will this disease affect my future? Are there any research advances? Is there a support group with other kids with this condition? What about pain management? And finally, the most profound, will I always be like this? So the physicians that care for these kids are some of the best in the country. They're from Stanford, there's from Chalk, and they've known their patients for many years because these kids, especially with genetic disease, were babies, and these doctors have worked with them for 10, 15 years. They couldn't believe that a patient was asking these questions. They're so profound. Because in the doctor's office, the dialogue is with the mom or the parent, and the teenager is sitting in the corner doing their homework or playing video games. They never have a chance to talk. They had no idea that their teen patient had these types of questions. When we ask them to personalize their health records, like what do you want to show your doctor? And so for this example, we see a prom picture, athletic awards, surfing, all of these activities. Again, there was nothing in here about what you normally think is in your health record. You know, how many times you fell, what your pain level. This was all about, I want my doctor to know me as a whole person. And these are all the things that I'm doing. And again, the physicians, they didn't know. They didn't know this guy was going surfing so much. They didn't know. They had no idea. It changes their own, even though they care about their patients, they start to see them more as a whole person. And in this example, they're filling out, we wanted to understand what, how would you describe your health condition? So here on the left, this person says, in describing their health condition, I am a generally happy person who has so much to be thankful for as anyone else. I have von Willebrand's, which is a blood disorder, and so I was formally diagnosed about 4 years ago, but I don't let this get in my way of doing things that I love to do. I take each day as it comes and try to make the best of everything. So here's a description of self. I'm a happy person, but I also sort of have this other thing going on. When we also asked, well, what would you put in your record and what would you have public, what would you have private? Because we were concerned about teens and what would they share. So you see broken arm, public, gaining weight is private, I'm angry with God, public, confirmation, public, making friends at school, private, you know, so gaining weight, so it's really, you know, what they're willing to share. And the most important thing here is a prescription to self. So we asked them, what's your prescription for yourself? And so this person wrote in, I need to remember who my real friends are at times and not treat them with disrespect. I can be a little mean sometimes. I need not to be. I also need to open myself up and make new friends and not be so shy. So what did we learn from this? And this is very typical, is that teens measure their quality of life, their health, based on their mood and their friends. It's very, it's obvious in a way, but actually to have this documentation is really important because this form is how the healthcare industry measures quality of life. And this is a pediatric quality of life form. And their questions are, you know, is it hard for me to walk more than 1 block? So what we're learning is that, you know, the teens, they value their quality of life. Can I go out? Can I go to Starbucks and have coffee can I meet with them after school with my friends? It's not about their pain level. It's not focusing on their condition. So, you know, this discovery of disconnections and design opportunities. Teen patients consistently define their quality of life through engagement with social networks and mood, not by illness. Oops. So the questions, are we measuring what's relevant to teens? Probably not. And can the means of measurement be more relevant? Yes. And this is really a challenge right now in using validated means of measurement. So the pediatric quality of life form, which you saw, is a validated means of input. It's been tested around the world. I think pretty much most doctors and nurses think that it has shortcomings, yet it's very difficult to change. So, but it's a quest. We need to understand the world through the patient's eyes so that they're getting the right feedback and what's meaningful to them. The next phase of the study moved into participatory design. So we got the teens back and started to work with them to design what would be helpful, what's going to help them become more independent so they're not, so that they can move out of the house, so they feel confident that they can manage their condition. And what was surprising to us was one of the things that came back was a desire for a robotic mom. The moms were, the moms of these kids couldn't believe it because they're perceived as the nag, and the kids are like, I don't want my mom, I know what to do, I want to be independent. And yet when it came down to what's the one thing that you want to take with you when you go to college or you move out of the house, the response was, well, I can't take my mom, but I could have a robotic mom. And it wasn't that these kids didn't have schedules and calendars to remember when to take their medication, because they do, but they wanted to be reminded by someone who cared for them. So there's an emotional aspect. It's a reminder tool, a prompt to take some medication is easy, but that doesn't fill the emotional need. So now I'm going to switch and start to show you what we designed and what we came out with. So using these design methods of research led to a concept prototype, which is a multidimensional tracking tool for teen patient reported outcome measures. That's a bit of a mouthful. We wanted teens to self-report. The prototype, co-created with teens, was voted Best New Product by Health 2.0 launch audience in April 2009. And this wasn't even a working product. We just had a prototype, but it did get some recognition. And I would love to hear your response to it as well. Now, this is a concept prototype. I often refer to it as a wireframe. It's not designed. It's designed to some extent, but it's really just placing content in the right location in order to get feedback from the teens in order to demonstrate the concept. So don't be too harsh on the look and feel of it. Consider it as a concept prototype. Loads of room for improvement. But as you can see, across the top is content that the teen can customize. So all of the things that they would want to put into their medical record and share with their doctor, pictures, exercises, reflection, can go across the top. Questions that the teen might have, things that they may want to keep for themselves, things that they might want to ask. They have control over their privacy measures, because we learned that teens can be very self-reflective and very profound, so they can capture these questions and thoughts for themselves. They don't necessarily have the skills in the doctor's office to dialogue. So we wanted to provide a receptacle for them so that they could put those questions in a place and ask them when they felt comfortable. And there's two views here. There's a visual view, which is for the teen, and then there was another kind of more linear view that could be optimized for a physician. The mood meter is what I'm going to go into more detail about, which is the thing that's captured the imagination of most people. And then the lower third was customizable for diverse data feeds, like posting photos or teleport medicine or various reminders. The mood meter, and this is a still shot, is the content is being pulled from the teen's text messaging. So we captured all of the texting that was going out of the phone. We did not capture sentences. When we were talking to the teens and talking about what would you want to share, would you share pictures you share your text messages from their friends? It was only words going out. So this landscape, each horizontal line is 1 day, and on the far left is midnight, and on the far right is 11:59. And you can see the mounds of the line is the amount of texting that was going on during the day. So it picks up around noon, and even though they're in school, you see there's texting really going on throughout the afternoon, into the evening, into the morning. Random words can come up in the back sky. In this example, stressing is selected, and the user can see where the term stressing was used in the landscape. In the magnifier mode, it allows the user to hover over the landscape, and you can see the top words that were used. So here it's exciting, dinner, nurse, mom. And I think there's a huge opportunity in algorithms of words to understand the mood of any individual. We did not take this any further than what I'm showing you, but I do think that this area of understanding word usage is really an area that hasn't fully been explored. So this whole interface is what I would call a bit of a feedback loop for the teen. And some of the learning that came out of it was a word with one of the young women of chemistry. And she noticed that chemistry was being used often during lunch and late at night. And often what happens in this kind of data visualization is that it prompts some self-reflection of like, oh, why am I using chemistry then? And as it turned out, chemistry was her class right after lunch, so she was stressing over it, she was worrying about it. And then it was often the thing that she was doing at night for homework. She had no idea how that was such top of mind. And often in these kind of chronic conditions, stress is something that you want to manage and try to avoid. So that's just one small example. So what's meaningful for teens is often meaningful for caregivers too. Teens are often written off as being disinterested, but I really challenge that stereotype. Teens just use a different language to express what they're caring about and thinking about. And teens want to improve their quality of care. So when they had the opportunity to share their landscapes and their images and thoughts with their dog, they took advantage of that. They wanted to have a positive conversation, but they wanted a holistic conversation. They didn't just want to talk about their disease. They wanted to talk about themselves in a holistic way. And as a result, the physicians that were involved in this study, they started to personalize the therapy for their teen patients. And another small example, but I think it starts to show the future of medicine, is that one of the doctors at Stanford talking to his teen realized that she wanted to go to the prom. She wants to dance. She likes to dance. So they were able to change her pain medication the week ahead so that she could dance. And those are small things, but for a teen, they add up. And those are the things that they can begin to take control over as they transition from, pediatric care to adult medicine, or a life of independence. So what we ended up with was creating a communication space, really for teens and their caregivers. Tools that increase self-awareness and spark meaningful conversation will empower teens for a healthy transition towards independence. So that is kind of really is this grant and this body of work is really the thing that totally changed the trajectory of my work and my practice. And then I just have one last slide to show you, just to maybe pique your interest even more in the healthcare arena, which was an article in the Wall Street Journal this last Sunday, and it's titled "A Doctor in Your Pocket. What does the future of medicine hold? Tiny health monitors, tailored therapies, and the end of illness." And so I just pulled this one excerpt, in that most of the conditions that kill us, including cancer and heart disease, could be prevented or delayed by a new way of looking at and treating health. The end of illness is near. So again, I just want to suggest and invite the audience to consider this arena as one that's changing very quickly and would benefit greatly by more designers making a contribution in this space. So thank you.
Is it fair to say that this is a new frontier for the kinds of design that you're practicing here? I mean, it seems like design and healthcare are relatively new partners in this. Is that in the way that you're doing it? Is that true?
Well, what has made the change is the breakthroughs in science where chronic illness is possible.
Mm-hmm.
I mean, it sounds crazy,
right.
But there were so many things that killed us,
right.
And now we can live with these conditions.
Yeah.
But the management of those conditions are falling on the patient.
Right.
So this is new, and it's part of the burden of the healthcare right now that they're trying to figure out. So designers can really make a contribution through experience design and looking at the world through the eyes of the patient, mm-hmm. to figure out how does somebody manage? What is the data visualization so that it's meaningful, mm-hmm. so that somebody can understand the relationship of their behaviors, their therapy, and quality of life.
Right. And does this have application all over the world?
This has huge application around the world because the chronic illness is a worldwide phenomenon.
Yeah, no, but I meant obviously the kids that you were working with had technology.
Yeah.
Right? So most other places people don't have access to these sort of tools. So how, and I don't expect you to answer how does it translate, but obviously the principles here apply, but are there ways to apply this in places where people don't have the connectivity that they do where you originally did it?
Well, there's
I know that seemed like a really stupid question. That's okay.
No, it's not stupid. The technology is becoming the cost is lower every year.
Mhm.
There's a lot that can be done with phones. That's really the universal tool. And so I don't see that as a limitation. And in fact, in some ways, the innovation is happening in developing countries because we don't, we're so restricted here in the US of what is FDA approved or regulatory or fear of the healthcare kind of insurance system. So the innovation could very well happen in other parts of the world and feed back into the US.
Just as in other areas. Erin is here with us, by the way.
I'm here off screen.
Camera shy today, but she's going to give us questions.
So we have a great question by Matthew Crislip, and he asks, can you talk more about the earliest stage of the design process, such as the development of methods of investigation and information gathering? How do you devise these methods? How are the roles shared and divided among the members of the design team?
The probe methods that we used are a combination of various groups, mainly out of the Scandinavian countries. You might be familiar with Bill Gaver, who is touted as being the kind of genius around developing the first probe. And that may or may not be true. But the purpose of the probes that he used were very much about inspiration. Sending something out into the world, getting feedback, pulling it back into the studio, and without any follow-up questions or really trying to understand what the participant was trying to say, just what do we get out of this? Does this spark a new idea? That was very liberating because so many kind of research methods are very rigid. And what I liked about it is this kind of open-ended approach. And for design and designers, sometimes that's all we need is a trigger to something that leads us to something else. However, while I was teaching, we took those methods and dickered with them and started pulling in other scholars and looking at different methods of probes. And it's a methodology by designers and for designers, in my opinion, because we're using methods of design, drawing, sketching, creation, storytelling, I mean, all of these things that for designers then to take and make their own interpretation has been very rewarding. And we've continued these methods within J&J, and it's been so eye-opening, and sort of opening up kind of this world that develops empathy for the participant versus sympathy. How they're developed, they're on the surface they seem simple, but they actually take a lot of work. They need to be kind of generic so that people can fill it in their own way. If it's too generic, then that doesn't really work. So you can't be overly designed, you can't be too undesigned. So there's a balance which you sort of discover. And there's it's like anything, how you divide the work. It's always a negotiation on a team. I don't think there's some set rules to that. So there's the design, there's the deployment, and then you get everything back and you have a room full of stuff that you need to kind of comb through, and you're looking at similarities and differences for patterns, and you start the analysis process.
We have another question from Jiyoung regarding the program. She wants to know about the program itself. She says, co-creation with kids is extremely interesting. Can we have that kind of opportunity to meet real users for our projects in this program?
Do you want to answer that first? That's an easy one.
Go ahead.
The answer is yes, absolutely. The program is really specifically designed around making these kinds of connections for students with real problems in the world, real people in the world, real contexts. And the wonderful part about it is that you will be led by extraordinary professionals and pioneers in their field like Lisa.
It seems that is most of our questions. I'm going to give it just a minute in case somebody else has another question.
I see someone, Anna is typing. Here, I'll read this to you. Ali says, it seemed like the Living Profiles was primarily a web or computer-based application. What do you think of expanding the boundaries of this concept to include mobile applications, print design, etc.? Is there potential to make Living Profiles a ubiquitous tool for teenagers' lives?
The project is an open source project. It's documented on Project Health Design, Robert Wood Johnson website. And I encourage anybody who wants to build on it to take it to another level. That funding closed, the project was complete, but I totally agree, in order for it to become adopted, it needs to grow beyond, the technology that we had at the time. This project closed in the end of 2008, so obviously technology has advanced since then.
All right. So I don't see any more questions.
Okay.
But we should mention that applications for the program
Yes.
our priority deadline is January 30th.
Do you want to come over here and announce that?
Should I sneak on screen?
Yes,
Yeah,
Aaron's going to sneak on
yeah.
screen.
Do
And
you
then
wanna sit here?
we'll just tell you about next week and thank Lisa profoundly.
Yes.
Okay, thank you.
Uh,
No, don't leave.
No, don't leave. Just
Can you-
I'll just come join you guys here. So applications for our program are open. The deadline is January 30th. If you have any questions, please feel free to get in contact with me. I'll send my email address out at the end of this and with a link to this recording. And next week
We have the reboot presentation from a group of authors who call themselves the Sabbatical Sisters. And they're going to talk about how to refresh yourself, how to take a break from whatever you're doing, maybe go to graduate school, and how to sort of find yourself and find sustenance and new energy in your life. So that will be a little bit of a detour, but one we think will be really fun. So we hope you join us next week.
Thank you for coming, guys.
Thank you.